You'll be contacted by your doctor or the commune when you're eligible to receive a vaccine. On the day of your appointment, you should stay home if you have cold symptoms, fever, or other signs of infectious disease, are in quarantine or waiting the results from a COVID test, have been vaccinated with another vaccine in the last 7 days, it's been less than 3 weeks since finishing isolation following a COVID infection, or you're pregnant and not in a risk group. Let the vaccination site know as soon as possible and your vaccination will be postponed. When you arrive, you'll be asked if you're healthy and if you have had reactions to other vaccines in the past. Most of the COVID vaccines require a second dose, which will be scheduled on the spot. The vaccine is given by syringe into the upper arm. Afterward, you'll be asked to wait around for at least 20 minutes to monitor for any kind of reaction. Everyone who administers vaccines has had training and necessary medication will be available to treat any possible allergic reactions. Side effects can occur up to 3 days after being vaccinated. So how should you deal with any potential symptoms? For typical symptoms like fever, headache, fatigue, muscle or joint pain, stay home until you are fever-free and feeling better. If the symptoms last more than 48 hours, consider getting tested for COVID. If you experience symptoms like a cough, sore throat, runny nose, wheezing, or loss of taste or smell, you should stay home and be tested for COVID. If you experience unexpected, severe, or prolonged symptoms that you think are related to the vaccine, contact your doctor or another healthcare worker for assessment and advice. Healthcare workers have a duty to report any serious or unexpected reactions that they suspect are due to a vaccine. You can also send in a notification yourself via helsenorge.no. It takes time for the body to build up protection. About 14 days after the first dose, protection is around 90% for mRNA vaccines. However, it's likely this effect will be reduced if you skip your second shot. Full protection is reached about a week after your second dose. Since the vaccines prevent COVID, they'll also prevent the spreading of it, but we don't know yet to what extent. That's why it's important we continue to follow the current safety guidelines for the time being. Now, what about the mutations? So far, it seems that the vaccines will still offer good protection against the mutations, though in some cases, the efficacy may be lowered. But it's important to remember that the vaccine will still have a very good protection against serious disease. Vaccination in Norway is voluntary, and vaccination against COVID-19 is free. Everyone living in Norway has a right to receive one. For details about how vaccination is being carried out in your area, check the website of your municipality. You can also call the CORONA HOTLINE, which is available in Polish, Arabic, Urdu, Somali, as well as Norwegian and English.